Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about pneumonia. Pneumonia is an infection or inflammation of a pulmonary parenchyma, and it is also known as pneumonitis. When there is an infection or inflammation of the pulmonary parenchyma, which is known as pneumonia, and it is also known as pneumonitis. Pneumo means lungs, as well as nitis means inflammation. Inflammation of the lungs is known as pneumonia or pneumonitis. Now we will see about the classification of the pneumonia. There are four types of classification, which is community acquired. Four types of pneumonia under the classification, which is community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia, health care associated pneumonia. These are the four types of the pneumonia. Now we will see about the pathogenesis. What are the cause of this pneumonia? Which causes pneumonia? Bacteria, virus and fungi. In bacteria, Haemophilus influenza, Chlamydia, Legionella, Streptococcus pneumonia. In virus, adenovirus influenza virus. In fungi, histoplasmosis. These are the pathogenesis which causes pneumonia. Now we will see about the defense mechanism of our lungs. There are three types, which is pseudostratified ciliated columnar epithelium, hair-like structure which is cilia is present. These are the things which are the pathogenesis of the pneumonia which can cause pneumonia. Now we will see about the defense mechanism of our lungs. There are three types of defense mechanism of our lungs. One is pseudostratified ciliated columnar epithelium, which is hair-like structures which is cilia is present on the respiratory epithelium. It separates the foreign body from the respiratory tract by coughing. The hair-like structure which is present in the respiratory epithelium has cilia in it. The hair-like structures are cilia. When the foreign body enters into that area, the cilia captures those foreign bodies and take out of the body by reflex a protective mechanism which is known as coughing. The next two defense mechanisms are IgA as well as macrophages. These both kills the foreign bodies after even it enters into the respiratory. It comes against the after coming out of the ciliated columnar epithelium. Also, this both IgA as well as macrophage kills the foreign body. When the patient is smoker, alcoholic, antitussives, which is anti-cough agents, opioid analgesics and sedative. When the patient consumes any one of this, which is these smokers, alcoholic, antitussive, the patient is more prone to pneumonia because this may give problems to the three defense mechanism which I have said above. So that when there is damage in the defense mechanism, they are more prone to the pneumonia. When the bacteria enters into the lungs, it damages the blood vessels which is known as capillaries. When the foreign body, which is the bacteria, virus or bacteria or fungi enters into the lungs, this causes rupture of the capillaries present there. So that the things which are present inside the capillaries comes out and causes pneumonia. How they causes? From the capillaries to the alveoli, the things comes from the capillaries due to the rupture of the capillaries. The things comes out from the capillaries, enters into the lungs, and this causes pneumonia by the four stages, which is known as pathological phase of the pneumonia. First stage is known as stage of congestion. The exudate from the blood vessels enter into the alveoli and may cause fill into the lungs. The exudate which is present in the capillaries enters into the alveoli and may cause fill of the lungs. The stage of red hepatization, RBCs enters into the alveoli. And the stage of grey hepatization, WBC fibrinogens enters into the alveoli. Here, the stage of red hepatization, the RBCs enter inside the alveoli from the capillaries into the alveoli, and the stage of grey hepatization is WBC fibrinogen enter into the alveoli. Now, the stage of resolution. The content which enters into the alveoli gets distracted into small particles, and this is because the alveoli is unfavorable environment for those blood vessels. The contents which is present in the alveoli right now gets distracted into smaller particles. This is because the alveoli as well as the capillary environment is not same, so that when the capillary enters into alveoli, the contents gets destroyed into the smaller particles, and these particles present in the alveoli now is known as consolidation. This consolidation damages the alveoli and causes pneumonia. Now we will see about the symptoms. Lung damage, which increases the respiratory rate. Generally there is lung damage due to the alveoli damage. There is increased rate of respiration, so that there is increased heart rate. Fever, chest pain, cough with sputum is seen. Investigation. First one, which is chest X-ray. Radio opacity is seen. Mostly in lobar pneumonia, there is triangular shaped radio opacity is seen because the lobes are affected. In bronchopneumonia, there is diffuse patchy opacity is seen. In intestinal pneumonia, the radio opacity at the perihilar region is seen. And the second investigation is gram staining and culture method. The third one is sputum collection. Rusty sputum, currant jelly-like, foul smelling sputum. These are the rusty sputum are Streptococcus pneumoniae. Currant jelly-like is Klebsiella. The foul smelling sputum is anaerobic bacteria. The fourth one of the investigation is ESR, which is erythrocyte sedimentation rate. The treatment of this pneumonia is antibiotics, antiviral and antifungal. These are the treatment of the pneumonia. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment in the comment box. If you want more other videos, please do subscribe my YouTube channel. Thank you.